Hey everybody, just coming at you for an update. I tried to make a video a minute ago and then Squirt started singing really loudly. Then the minute I pause it, he stops singing suddenly. I'm not sure what his deal is today. But the update is that I have an appointment with the surgeon on November 10th at 3:30 p.m. I see this surgeon for the consult, and I believe the dietitian. Not sure if I see any of the other team, but they have, the surgeon, the dietitian, and the nurse, and maybe a physical therapist. I'm not really sure. So yeah, that's good news. There has been insurance difficulty. They approved to see the surgeon, but gave me until tomorrow, but then never called or let anybody know that it's been approved. And I guess somebody faxed something to the wrong office, but they're figuring that out now, and I had to ask the primary care to get an extension on the referral. And also there's been a big change with my primary care. The doctor I was seeing there suddenly not there anymore. I don't know if she's on vacation or what, but it's been almost 2 months now that she hasn't been there. I hope she's alright, but the doctor there's another doctor there, and I guess he's only there until in the morning. Not sure if there's anybody else, but I hope there is, because this is the doctor that I saw before coming to this office that would not help me out with the surgery. And he was kind of, I don't know, I didn't like him very much, or like his bedside manner, whatever you want to call it, and I ended up switching. So yeah, what are the odds that, he follows you to your office? I really want to switch, but I can't at this point, because then I would have to go through the whole referral thing again. And so I figure, after I have the surgery, I'll switch then if she's not back. But I really hope she's back. Because the surgeon's office wants the doctor to write a letter saying why they think I'm a good candidate and this and that. And I don't really know if the guy supports this. But the preoperative tests that I have to get are starting to freak me out, I think. One in particular. It's an easy test for a lot of people, but I guess I'm special. I have to do an upper endoscopy, which I'm not really worried about. I've read that they pretty much knock you out. And I was talking with someone and they said, well, we always imagine it's worse than we are, when it really is. And that's probably right. You imagine some big movie camera or something going down your throat when it's probably just a tiny little, probably not even wider than a cord for a little lamp or something. I guess a lamp cord's big, but I mean like the little tiny wires. So I'm not too worried about that. I had the EKG yesterday, and I think I passed. No one said anything, so I have to call the hospital to get the records for a chest x-ray I had when I went in for asthma attack about a month ago, I think. So that should be interesting. So, my insurance is so nice that they always give you what you want. But there's also some blood work. I've done some of it already. The other, she's gonna mail it. And then, sorry, he's making a tent on the couch with stuff he shouldn't be into. And then there's the test that I probably really don't want to do. It's an important test to get yearly, but I haven't got one since probably 2005. For a few reasons. The test I'm talking about is a pap smear. Now, lots of people get those. Squirt. But I've always had troubles getting those because it hurts so much. Nobody wants to go slow for me. Nobody wants to give me a Valium or anything. They just... I've even used the pediatric speculum, and that hurt way too much. It gets to the point where I get panic attacks just thinking about it. And if that's not bad enough, you know, there's a whole back, leg, and hip situation with me. I can't move my left leg. It hurts really bad to lay on my back. And to have my leg lifted in those stirrups, I don't even know how that's going to happen. Sorry, but I don't know if you see making a tent with the blankets. It's silly. I guess he finds fun in everything. Maybe we should all take hints at that. So yeah, I'm really freaking out about that test, you know, more than the upper endoscopy. Also I got the primary care that I saw yesterday. He wrote a referral for the upper endoscopy. And I found out I might have to drive all the way to Oakland just to get one, because that's the only doctor that my insurance, or takes my insurance in the area, which that's about a 2-hour drive one way. Sorry, Squirt's cracking me up. You know, if I have to do that, I have to do that. You know, same with this other test. If I have to do it, I have to do it. I just wish I could find somebody that can, you know, meet my needs, but I don't have a gynecologist. I'd probably have to get a referral and wait several months just to get one. And I've been to all the ones that accept my insurance, and none of them have wanted to do that. They would always say, well, if you lost weight, it wouldn't hurt, or if you did this, it wouldn't hurt, but it's not true. I mean, maybe the weight is true, I don't know. I just know it hurts really bad, to the point where I've passed out from it. Squirt, don't eat the tape. First time I passed out, hit my head and fell off the table, landing on my head. I ended up with a big welt, like right here. Other times, just the doctor's not wanted to go slow. If I say stop, she does not stop, and that really freaks me out, because I do have a history of abuse, like 20 years worth, and you know, you say stop and they're not going to stop, it kind of, you know, puts you back in that time where you're being abused. And you know, I've left crying and, you know, saying, oh, I never want to do this again, never want to get in a relationship, and you have to get these exams, and it's just an awful thing. You know, I just wish somebody would go slow, but I also wish I didn't have this pain in my back, you know. And then another time I was in the hospital, and I remember I went in because it was my gallbladder, but they were trying to do all these other tests. One of them was a pelvic exam for no reason. And I just remember a bunch of nurses holding my legs down, trying to do that, and I was having to kick and punch my way out of there. It was that bad. They called me some names too, which was very uncalled for, and thinking about it now, I probably should have said something to somebody, but, you know, I didn't. Squirt. I'm being serious here, and Squirt's getting in trouble. But that's the test that I fear most. Like I said, you know, panic attack just thinking about it. And I really don't know where I would have one done, because, you know, my doctor's office is this guy, and I don't really like him, and it's going to make me tense up even more for that, and, you know, I just wish I didn't even have to do one. But if anyone has any suggestions about that, you know, I'd love to hear them. You know, it's been a pretty difficult thing.
you know, not being able just to get that. You know, I kind of figure I'll probably never have kids just because I can't take the exams. You know, but maybe the surgery will help with that too. I don't know. Like maybe it is the weight pressing on it. Who knows? My time's about run up, but I'll keep you guys updated on what's going on with the tests and everything, and hope you guys are doing good, and I'll talk to you soon. Bye.